to ensure that Canadians are supported. As you know, this week, Prime Minister Trudeau will host a First Ministers meeting with premiers to continue these urgent discussions surrounding our collective response to COVID-19. It will be our 23rd meeting with premiers since March, and this is a meeting that we are very much looking forward to. Nous pourrons discuter des questions urgentes liées à la pandémie, notamment en mettant l'accent sur les vaccins et sur l'importante discussion concernant les moyens de renforcer notre système de soins de santé. Dès le premier jour, le gouvernement fédéral s'est engagé à concentrer sur les besoins des Canadiens pendant la pandémie. Les Canadiens s'y attendent et ils ont absolument raison. Our government has provided, as the finance minister and the prime minister have said, 8 out of every $10 spent by all governments in the fight against COVID-19, investing $322 billion to support Canadians since the beginning of the pandemic. From protective equipment to rapid tests, we have sent the provinces. Our government has been there every step of the way. Canadians want us to remain focused on seeing them through this pandemic, and that is exactly what we are focused on. Thank you very much. Merci beaucoup. I would now like to invite Dr. Tam and then Dr. Words. Yes.
Good day, everyone. Bonjour à toutes et à tous. There have been 423,054 cases of COVID-19 in Canada, including 12,777 deaths. Nationally, there are over 71,540 active cases across the country. And over the past week, labs across Canada have tested an average of over 80,000 people daily, with 8% testing positive. Yesterday, 6,499 cases were reported nationally. In addition, there were over 1,370 new cases reported for Saturday and Sunday. So this brings the average daily case count to over 6,415 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,680 individuals with COVID-19 being treated in Canadian hospitals, including about 530 in critical care, and an average of over 92 deaths were reported each day. Yesterday, the Government of Canada announced some good news about vaccines amid our ongoing concerns about rapid growth and increasing severe outcomes of COVID-19 in Canada. Pending regulatory approval, assuring quality, safety, and effectiveness, Pfizer is set to provide us with up to 249,000 early doses of a COVID-19 vaccine in December. But it is important to stress that, as welcome as this news is, it does not mean that control of COVID-19 will be quick. Initial supplies of COVID-19 vaccines will be limited, but supply will gradually increase until there is enough to provide access for all Canadians. During these initial stages of vaccine rollout, it is crucial that we all continue with public health measures to protect ourselves and others. The response to the COVID-19 pandemic is the biggest collective effort of our lifetimes. It has relied on the effort of all Canadians, from individuals, institutions, all levels of government, and across sectors. As we embark on Canada's COVID-19 vaccine response, I am confident that together we will be successful in rolling out one of the most complex operations ever to take place in public health. Canada has an existing strong foundation for pandemic response, including vaccine regulation, distribution, and delivery. In addition, our partnership with Major General Fortin and the Canadian Armed Forces has added significant expertise and experience to manage the complex operational and logistical arrangements. Knowing safe and effective vaccines are within sight might lead some to think COVID-19 is no longer a problem, but the reality is very different. Canada and many countries around the world are still experiencing high infection rates, which has placed intense strain on hospitals and health systems, as well as the health workers that have been responding to this crisis for many months. So we need to keep telling ourselves, this is not a race to the finish, but a test of our continued collective effort and resolve, and we will endure. For now, we must all continue to follow local public health advice and maintain individual protective practices that will keep us safe along the path ahead. Merci. Thank you.
Bonjour à toutes et à tous. Il y a eu 423 054 cas de COVID-19 au Canada, dont 12 777 décès. À l'échelle nationale, il y a plus de 71 540 cas actifs. Au cours de la dernière semaine, des laboratoires de toutes les régions du pays ont analysé les tests de dépistage de plus de 80 000 personnes par jour, dont 8 ont reçu un résultat positif. Hier, 6 499 cas ont été signalés au pays. En outre, plus de 1 370 nouveaux cas ont été signalés pour les journées de samedi et de dimanche. Cela porte à plus de 6 415 le nombre moyen de cas signalés quotidiennement au cours de la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, plus de 2 680 personnes atteintes de la COVID-19 en moyenne ont été traitées dans les hôpitaux canadiens, dont environ 530 se trouvaient aux soins intensifs. En outre, plus de 92 décès en moyenne ont été signalés chaque jour. Hier, le gouvernement du Canada a annoncé de bonnes nouvelles au sujet des vaccins, malgré l'inquiétude qui persiste au sujet de la croissance rapide et de l'augmentation du nombre de cas graves de COVID-19 au Canada. L'entreprise Pfizer est prête à nous fournir en décembre jusqu'à 249 000 doses initiales d'un vaccin contre la COVID-19 sous réserve de son approbation réglementaire qui en garantira la qualité, l'innocuité et l'efficacité. Cependant, il est important de souligner que même si cette information est encourageante, cela ne signifie pas que la pandémie de COVID-19 sera maîtrisée rapidement. La quantité de vaccins contre la COVID-19 sera d'abord limitée, mais elle augmentera graduellement jusqu'à qu'il y en ait suffisamment pour que tous les Canadiens y aient accès. Pendant les premières étapes de la distribution des vaccins, il sera indispensable de continuer d'appliquer les mesures de santé publique pour nous protéger et pour protéger les autres. L'intervention à la pandémie de COVID-19 représente la plus grande action collective de notre vie. Elle repose sur les efforts de l'ensemble des Canadiens, à savoir des individus, des institutions, de tous les ordres de gouvernement et de tous les secteurs. Alors que la campagne de vaccination contre la COVID-19 s'amorce au Canada, je suis convaincu qu'ensemble, nous réussirons à mener à bonne fin l'une des opérations de santé publique les plus complexes jamais mises sur pied. Le Canada dispose déjà de solides bases pour la lutte contre les pandémies, notamment pour la réglementation, la distribution et la livraison de vaccins. De plus, notre partenariat avec le Major général Fortin et les Forces armées canadiennes nous permet de tirer profit d'un savoir-faire et d'une expérience considérable pour gérer les aspects opérationnels et logistiques complexes. Savoir qu'il y aura bientôt des vaccins sûrs et efficaces pour amener certaines personnes à penser que la COVID-19 ne pose plus problème. Mais la réalité est tout autre. Le Canada et de nombreux pays enregistrent toujours des taux élevés d'infection, ce qui met à rude épreuve les hôpitaux et les systèmes de santé, ainsi que les travailleurs de la santé qui interviennent dans cette crise depuis de nombreux mois. Nous devons donc nous dire qu'il ne s'agit pas d'une course, mais plutôt d'une épreuve d'endurance exigeant de la solidarité et de la détermination et que nous nous en sortirons individuels qui nous garderont en sécurité. Merci.
Thank you. Merci, Dr. New. Thank you, Dr. Tam. So obviously now we're open to questions, and Major General Fortin will be prepared to answer any questions around the logistics involving the vaccine rollout.
Merci beaucoup. Donc, nous allons commencer avec les questions au téléphone pour 3 questions. Chaque personne a le droit à une question et une question de suivi. We will start on the phones for questions, for 3 questions, 1 question and 1 follow-up. Opérateur, c'est à vous.
Our first question, la première question, Raymond Filion, TVA. Your line is open. À vous la parole.
Merci. Une question pour le ministre Dominique Leblanc. Monsieur Leblanc, j'aimerais vous entendre au sujet de la rencontre de jeudi avec les premiers ministres. Vous en avez parlé dans votre déclaration. Les provinces réclament, comme vous le savez, 28 milliards de plus par année. À quel point c'est réaliste comme demande selon vous?
Bien, comme vous le savez, depuis plusieurs mois, le premier ministre Trudeau a accepté la demande des premiers ministres des provinces et des territoires d'avoir une discussion sur la question des soins de santé et comment garantir des soins de santé accessibles et de qualité à long terme. On a vu évidemment la demande fournie par les premiers ministres pour cette augmentation-là. Nous sommes évidemment heureux d'avoir la conversation, de débuter la conversation avec les premiers ministres ce jeudi, après-demain. Mais nous allons aussi constater l'énorme investissement du gouvernement fédéral dans les mesures de santé publique, dans les mesures d'appui aux Canadiens, aux entreprises canadiennes depuis le début de la pandémie. Si la pandémie a nécessité des investissements fédéraux qui dépassent le 300 milliards de dollars,
caused the government to invest over $300 billion, and we will continue to support Canadians and provinces and territories in their important healthcare needs in the context of the pandemic. So we will discuss that issue, and of course, we will also discuss with premiers of the provinces and territories. We'll talk about the importance of coordinating the logistics of vaccine distribution. We hear that you would prefer to focus on the pandemic on Thursday rather than on long-term financing for the provinces. Is that correct? I believe that Canadians expect their government, both the federal and provincial governments, that they focus on important issues linked to the pandemic, the COVID-19 pandemic. It's not surprising that the provinces and territories would want to gather to discuss healthcare issues. Yet we need to keep on focusing on working together to fight COVID-19. We will talk about the arrival of the vaccines, and we recognize that the federal government spent $8 out of $10 to help support Canadians throughout the pandemic. We have transferred over $20 billion already to the provinces and territories to help them, for instance, to purchase personal protective equipment and to help them with contact tracing. And so we will keep on helping the provinces and territories in a very significant manner. And we are looking forward to a conversation on how we can work together to ensure that quality and accessible health care is there for Canadians in the long term. We share that objective with the provinces.
Prochaine question.
Merci. Thank you. Our next question, la prochaine question.
Hello. I think this question's for Dr. Tam. Yesterday, officials in Ontario said long-term care residents may need to wait for the Moderna vaccine because of advice from Pfizer to avoid moving it from its initial delivery point, something that Pfizer confirmed to us. Will this delay vaccination for long-term care residents across the country, and was this unexpected?
So I think it's a rapidly evolving situation. So I think everyone has to remain flexible and adaptable. And I think some of this will come through the dry runs and all these preparations that we will have initially. That is the concept at the beginning of rolling out the Pfizer vaccine, is to try and sort of keep it at the point of use. That's for a start. I expect that as more information, as more experience with the vaccine and its transportation from the initial site of where you deliver the vaccine, that will change. So I do think that's a fluid situation. But it's true that you cannot move residents very easily from a long-term care facility to a vaccination site. So that's just the realities. In the meantime, you got to continue to protect long-term care facilities, as I said, using all the public health measures necessary, and including testing and screening and personal protective equipment to protect our elders.
Okay, thank you. The next question is for the Minister, LeBlanc. U.S. President Trump is expected to sign an executive order today to ensure Americans have priority access to COVID-19 vaccines. And I wanted to ask if you think this will affect the delivery of the up to 249,000 Pfizer doses expected next week here in Canada. And does Canada have any recourse if this executive order does in fact make it difficult to bring vaccines to Canada from the United States?
So we're very confident that Pfizer and other vaccine makers that are contractually obligated to deliver doses to Canada will be able to meet those obligations. We've said from the beginning, we have a very diversified portfolio, one of the best in the world in terms of different doses, different companies, obviously all subject to the appropriate regulatory approval by Health Canada. But with respect to the Pfizer doses that we expect to start arriving in the coming days, in the next week or so, we have already assumed that we shouldn't be tied to one particular manufacturing site. So the contracts themselves contemplate that Pfizer, for example, has manufacturing facilities in Europe as well as the United States. So we're confident that there won't be any disruption in the effective and timely supply of vaccines to Canadians. We contemplated that in the procurement agreements we've signed.
Merci. Prochaine question.
Thank you. Merci. Our next question, la prochaine question, Catherine Lévesque, La Presse canadienne. Your line is open. Please go ahead.
Oui, bon. Good morning to all of you. My first question is for Major General Fortin. I know you referred to this yesterday, but can you give us more details about how the vaccine distribution will roll out, namely for the vaccines coming in the next few days? Where are they going to arrive? How will they be distributed to the provinces? And how will they ultimately be administered? As I said yesterday, there will be 14 initial distribution sites have been identified by the provinces for Pfizer's vaccine. Those places were chosen by the provinces. They meet certain criteria. Some will be in hospitals. We're also taking into account that there will be enough competent medical professionals to carry out everything that needs to be done from the moment the vaccine is received in a thermal box. The handling of the doses up into the administration of the vaccines. The provinces have chosen additional sites, and over the coming days and weeks, we will start to activate those sites. They were chosen based on the conditions laid out by Pfizer so that the vaccines can be administered as quickly as possible to all Canadians.
So this week we start small, dry run, and then next week start. The expectation is that we start receiving, or at least we're postured to receive vaccines in 14 initial locations selected by the provinces. And they were selected based on the fact that they require the right personnel with the right qualification in sufficient numbers and the right facilities in hospitals and similar type of facility. Additional sites will be turned on over the next days and weeks by the provinces. They selected those sites, and they will activate those at a pace that is appropriate for the quantities that we expect to receive. And then we'll be able to, with the provinces in the lead, administer the vaccine at scale as they become available. And they were particularly chosen so that they can be close to the population that will receive the vaccines, and the appropriate measures for the handling of the vaccine are being considered. So this is very much with a view to having vaccine accessible to as many Canadians as possible, as rapidly as possible, and as safely as possible.
Oui, donc en suivi, j'aimerais juste...
As a follow-up, if I may, Pfizer is going to distribute the vaccines in the coming days following approval by Health Canada. So where exactly will the doses arrive in Ottawa? And are the doses then going to be flown out to other locations? Can you break down the stages before the vaccines get to their final destination? Sure. Pfizer will bring the vaccine to Canada, and Pfizer, in fact, will bring the vaccines to the 14 distribution points and then to the further sites. So the company will be doing that. What we're doing this week is to make sure that the delivery process, the transfer process, the cold supply chain is ready and in place. But Pfizer itself, with the service provider it has chosen, will distribute the vaccines as quickly as possible.
Passer dans la salle pour 3 questions. Ils reviendront au téléphone par la suite. We will now come to the room for 3 questions. We'll come back to the phone after that. Honda, off to you.
Honda McCharles, Toronto Star. Since we're on the dry run and stuff, Major General Fortin, can you talk about the dry run so far? I gather it goes all week, but so you started it yesterday. What did it look like? What holes did you find? What challenges do you see you have to address in the next while?
Thank you. So it's too early to tell what we learned from that. But one thing for sure is that we initiated the process last week. Really, yesterday, the orders were received at Pfizer, and Pfizer, sent shipping or thermal shippers. So those boxes that were put on the plane yesterday. Yesterday, about this time, they were in the air, and they were flying from Belgium and through different nodes, transfer points. They will make it to Canada in the next day or day after. Upon arrival at the points of use, the data reader will will be able to get the reading from the data reader, so we'll have a good sense of the temperature throughout the journey, and we'll have identified if any critical or failure or friction points in the critical path. Today, people are being trained on this, and then upon receipt, they will handle the package, and they will have learned as a result and share those lessons across the population or the public health enterprise. There are empty. There are no vaccines. There are empty boxes, but they have dry ice, and they have to be handled with the appropriate care.
Thanks. And if you could also address, there is some questions still around. You mentioned the other day that the Indigenous leaders up north have said to you they want to wait till the Moderna comes along or another vaccine where they don't have such stringent freezer requirements. But could you address more specifically right now where planning is at for the federal government to distribute to the populations it's responsible for, including Indigenous and First Nations, including military personnel and their families and veterans, and including prisoners?
I can cover some of that. So in close cooperation with the provinces and territories, we're identifying those points of use, realize how complicated this can be using different language, but there's a difference in how the Pfizer vaccine and other vaccines are handled, and the Pfizer vaccine has particular requirements with the ultra-low temperature chain. But the territories have indicated a preference for the Moderna and other products, as they are easier to handle because of the particular requirements, as I said, of the Pfizer vaccine. So we're in daily discussions with territories and provinces and agencies and other departments to pinpoint the process, the locations, and ensure that everyone's or every stakeholder's perspectives are accounted for in the plan. And this week, as we continue to rehearse, we identify those additional points of discussion, and we ensure that we have clarity amongst all stakeholders as to the way forward. So we'll continue to adjust as we move forward, but the provinces and territories, that is, really are pulling in the sense of indicating what the locations are going to be, and they will put in the orders as appropriate.
But the federal, not for the prisoners and military personnel.
Yeah, thank you. So for the other populations, the CAF, the Canadian Armed Forces members, Corrections Canada, this is very much a part of those discussions as well. And where exactly they sit in the priority, I'd have to come back to you. But they will get a small amount of vaccines in the first quarter to address those populations at risk, as per the guidance received and being applied across Canada.
Maybe I'll just add that the vast majority of vaccine will be deployed and implemented by the provinces and territories. Very small numbers are expected to address those very specific federal populations that don't get it from the provincial territorial system, that being healthcare workers, for example, in corrections, and the CAF, Canadian Armed Forces, or some elderly populations within that context. So they will follow the sort of prioritization approach as well.
Merci. La prochaine question. Bonjour, Juliane Lapointe de Radio-Canada. Sur l'exercice de...
With regard to the dry run, Major General Fox is going to roll out, it might be too early to reach any conclusions, but the 249,000 doses will soon arrive. So will there be enough time to fully rehearse before the vaccines actually get here? This week, the key is to take lessons learned. The provinces are all following the dry run. So the cold boxes arrive, and then the other stages roll out their product. And the lessons learned there will be shared. And from that, everybody is going to work towards the appropriate state of preparation for the other sites. Containers have been put in place. The material required for vaccination is being distributed by the provinces as we speak, including any federal equipment made available to the provinces. All of that is happening right now. So we're in a very good position to get started next week, and then to increase the number of those sites and their capacity. Perhaps I can add a few words about the vaccination about certain populations. We have integrated teams. We have the public health teams and then the logistical teams, and we're working very closely because we can't have one side without the other. We all agree that the first people who will receive the vaccines will be the elderly, people in long-term care or retirement homes. Do you believe that Pfizer has conducted enough tests on the elderly for the vaccine to be safe? You don't think that we're playing with the lives of the elderly. No, we trust our Health Canada regulatory colleagues. They are the ones who are analyzing the data, the evidence from the clinical trials. There are many groups of people who have been involved in the clinical trials, which have been carried out on people of all ages, including on elderly people. So once approval is there, all Canadians can trust that the certified vaccines of Pfizer and the other vaccines as well will be safe and effective.
Go ahead.
With CBC. I just want to clarify with the minister. Are we getting all our Pfizer vaccines from Europe? I'm just trying to find out if there's any effort by the U.S. administration to block exports, if there's any chance that our supply could be interrupted.
So, as I said, I'm very confident that the procurement contracts contemplated a diversity of supply. We have no reason to think whatsoever that access to the Pfizer vaccine will be in any way disturbed. And as I said, deliberately in the contracts themselves, we contemplated having access to production facilities on more than one continent. So we're very confident that the commitments that Pfizer made can and will be respected. And that's important for the entire duration of the exercise. As Dr. New, I think, just said, there's the initial, but this process will continue and ramp up in 2021 in a very significant way. So we're also confident that the contractual obligations with Pfizer, but other suppliers also will be respected. We're not concerned.
In terms of monitoring people who get the vaccine, making sure that they get the second dose, is it the province is going to be primarily responsible for that? Is there any federal role? And is there any federal role as well for monitoring any adverse reactions or side effects to the vaccine?
Yeah, so there's, again, a role for each level of government, I would say. So for vaccine coverage, the provinces or the local administrators of the vaccine have to actually record, of course, who got vaccinated and provide them with their own way of recalling them, if you like, for the second dose. And so that is up to that level of support. We also know that provinces and territories, almost all, have their own immunization registries and their system of recording. But really, the discussion is that they will be sending us information regularly on the actual coverage, for example. But the specific one, first dose, second dose, that's very much on the ground implementation and responsibility. Vaccine safety is a really important aspect of monitoring. As you can imagine, the clinical trials are actually really quite big compared to other vaccine clinical trials with 30, 40,000 people in each, during which we will see from the regulatory authorities what kind of side effects might be experienced. We haven't heard of any serious side effects so far, which is great. But when you actually begin to roll it up into millions of people, even rare side effects need to be detected. For that, we have a foundation of several layers of surveillance and monitoring. Health Canada, as a regulator, has the Canada Vigilance System requiring reporting. They are going to have requirements of the actual manufacturers to provide more information after approvals. The public health system can report in, and with the Public Health Agency of Canada, called the Canadian Adverse Effects Following Immunization Surveillance System. That's just routinely, it's already happening on an ongoing basis. Then we have networks of additional systems looking at, from hospitals, for example, detecting more serious adverse events. On top of that, there are research networks that will be ready and clinical networks that will be consulted if someone has an adverse effect following an immunization, as well as more in-depth studies if adverse effects should occur. So it's really it's a robust layering of many different sources of information. Of course, if we detected a signal, there'll be a rapid response to investigate a signal that's detected. So then on the aspect of actual coverage, other than provinces reporting to us on the numbers that's been delivered, we are already planning actual surveys with, in collaboration with Statistics Canada. Now, those go into more depth. They can answer different questions in terms of who got vaccinated, their experience, their knowledge, and that's, you can dive in to look at further unpacking the people and their experience who got the actual coverage. So there's going to be quite a few different streams that will be at play. We are also looking at augmenting the information technology platforms as well as needed to support this sort of network of different systems at play.
I think if I could just add to what at the end of, I know my Patty Hyde, to provincial and territorial health ministers, about the importance of having access to the appropriate common platform, so this very complex data can be tracked and used appropriately in terms of the safety. It was a comment that Premier Fury, who, as you know, is a medical doctor himself, raised in the last call with First Ministers and Prime Minister Trudeau. Dr. Fury said that he believed it was very important that we have access to this common platform across the country so that the safety and efficacy can be tracked. And I know that's something he told me in recent days that he intends to continue to bring up with ministers in a collaborative way to ensure that, as Dr. Tam said, all of that data can be captured in the right way.
World Juniors are going to be, World Junior teams are going to be coming this weekend to Alberta. Sweden and Germany have had members of their team test positive for COVID. They're not taking part in the tournament, obviously. Do you have any concerns about teams being allowed into the tournament when they've had incidences of COVID on their squads?
Thank you very much for the question. I guess I get all the sports questions. Yeah, we've been in active discussions with the officials in Alberta, both public health as well, obviously, with Hockey Canada. The protocols that we've seen from a pure technical public health perspective, I think I've mentioned this earlier, look good with respect to the fact that they're going to be using or intend to use the same bubble concept as was successful for the NHL and also for the NBA with their playoffs last year. Having said that, though, everyone's also well aware that there's a larger context. You could have a tournament in a bubble, but there's also the situation epidemiologically, what's happening both in Canada, the U.S., and as you now have alluded to, in other countries. So that's something we're keeping an eye on. Certainly, all of the participating countries and teams are well aware of the types of protocols and the public health measures that all of the not just the players themselves, but the team members need to be practicing in advance of the tournament. But certainly, as we get closer to time and people are actually planning to travel, that'll be revisited. I think in general, we're very mindful that it is a federal responsibility for our borders. And certainly, I think what we've been doing is looking on a case-by-case basis in terms of what kind of events could be, I think, reasonably sort of undertaken or held in Canada in terms of, I guess, high-performance sport in this case. Thank you.
Thank you. We will go back to the phones for another 2 questions, and then we will come back to the room. We have about 15 minutes left, so please keep your questions and answers. Opérateur.
Thank you. Merci. Our next question. La prochaine question, Boris Proulx, Le Devoir. Your line is open. À vous la parole.
Bonjour.
Yes, hello. Yesterday, the Prime Minister said he was confident that Health Canada would approve Pfizer's vaccine this week, and that was repeated today. I would like to know how you can state that and whether Health Canada is waiting for the U.S. FDA before giving its own green light to go ahead. Thank you for the question. what I can tell you is that Canada's regulatory process is one of the best in the world. I believe that Canadians can have a lot of trust in our regulatory system. It's also important to point out that Canada's regulatory process is independent. Now, clearly, Health Canada's experts are constantly communicating with their peers in other countries, but we don't depend on other countries when it comes to Canada following its own processes. As far as I understand, we are in the last stages of analysis of the data, and we're looking at the data provided by Pfizer, Moderna, and others to Health Canada. We're expecting a decision shortly, and all indicators are such that I'm optimistic and many other people are optimistic too. However, we need to respect the process and the independence of our regulatory system. At the end of the day, as I already said, it's important that Canadians trust their country's regulatory system and that any vaccine certified in Canada will be safe and effective. Thank you. As a follow-up, I'd like to change the topic a little bit and perhaps hear Dr. Tam on this as well. Some groups, such as the Justice Centre for Constitutional Freedoms, which has published articles stating that the lockdowns are causing more harm or more deadly than COVID-19. You can read that kind of information on social media, on Twitter, and elsewhere. So I'd like to know what you think of that. Is this misinformation? And is it true that people are dying because of lockdown? Thank you for the question. Clearly, Dr. Tam, myself, and others are keenly aware that on social media, there is all kinds of information. This is, in fact, is the first pandemic which is happening in the era of social media. So I think it's important to make Canadians aware that they should be careful about information shared by others. It's important to check up on the source of the information. Canadians should get their information from reliable sites. There's so much out there. People share information with their friends, and the misinformation is spreading virally. So it's important that, for instance, the media, journalists here, for instance, inform Canadians and to share credible and reliable information. The Government of Canada sites are reliable, and there are other sites, the CDC sites, the World Health Organization site are also reliable sources of information. Perhaps Dr. Tam would like to add something, but clearly it's very important to keep on telling Canadians about what is actually happening on the ground, letting Canadians know that vaccines will soon be distributed. And I like to be optimistic. We want to build Canadians' trust in vaccines, and we'll see what next stages are and what we can do next in that regard. Dr. Tam?
Add that, of course, as the public health system is well aware of some of the negative consequences of some of the public health measures. But at the same time, as this pandemic escalates in Canada and overwhelms public health systems and the healthcare system itself, where hospitals can't cope or ICUs are full, there's a lot of other impacts on health from that perspective. But everyone is cognizant of the fact that people need to be supported to carry out the public health measures. There's mental health support as well as social and economic support that's required. So yes, there are negative consequences. Yes, we need to do as much as possible to support people while they're doing their best to observe public health measures. But if you do not slow this virus down and your healthcare system can't cope, that can lead to a lot of negative consequences, which you can see in many European countries that have just a bit ahead of us. And if you learn from them what's happening in this resurgence, it's pretty clear that we have to do more in many areas of Canada to slow down the epidemic. Thank you.
Oui, c'est Dr. Newby.
Share these statistics, and in some parts of the country, our healthcare systems might soon be overloaded. We're in a crisis right now. We need to act right now. Thank you.
Merci, opérateur.
Our next question, la prochaine question, David Akin, Global News. Your line is open. À vous la parole.
Good afternoon. A question perhaps for both Minister LeBlanc and Dr. Tam. I'll sort of put the context this way. We are now seeing the provinces release their vaccine priority lists. We know it's a provincial authority to do this. Quebec yesterday, Ontario yesterday, last week Alberta, tomorrow BC, later today Saskatchewan. All provinces so far have modified the federal NACI recommendations a little bit. But nobody yet is saying that we ought to base our priority based on occupation. In other words, truck drivers or daycare workers or teachers. It's really all got to do with where you live, in residences, work in a hospital, live in a First Nations community, or how old you are. And I just wondered, as a matter of trying to convince the public that these priority lists are the right ones and the defensible ones, Dr. Tam, you may have just touched on it a bit by saying, keeping the healthcare system going is a pretty top priority. But I'd like to hear perhaps both of you comment on why or why not we shouldn't be grouping people by occupation, or for another example, students, so that students can get a vaccination and get back to class, et cetera, et cetera. That's the only question I have, if both of you could respond to that.
Thank you for the questions, David. I'll take a crack. Dr. Tam I think said from the beginning, and my colleague, Minister of Health, Patty Hajdu, has had a number of very constructive, collaborative conversations with her provincial and territorial counterparts. So has Dr. Tam and Dr. New with their counterparts as well. So this has been a long-standing conversation. The National Advisory Council on Immunity and Immunizations is composed of scientific and medical experts who have continually revised their advice as more is known about particular vaccines, about some of the challenges that Major General Fortin spoke about, for example, in handling certain vaccines as compared to others. So this is very much an evolving space. We've said also, as you noted in your question, that ultimately it is provincial jurisdiction to decide on these priority groups. We hope and believe that they will be informed by this reliable scientific and medical advice. At the end of the day, those policies should rest on the advice of healthcare professionals, should be administered to a population. But the important thing for us too is that when the process concludes, we will have had more than enough doses to vaccinate every Canadian who wants to be vaccinated. And as Dr. New said, we remain very optimistic and confident that Canadians will see the value in being vaccinated and will have confidence in the outstanding work done by scientists and doctors to develop a safe and effective vaccine that can be widely distributed to everybody, because that's how we're ultimately going to get the immunity that we need as a country.
Yes, this is Teresa. They don't stop at those initial four key groups. It continues on to initially resident staffs or congregate living, and then healthcare workers, particularly those in direct patient care, seniors starting from the oldest, adults in indigenous communities where infections can have disproportionate consequences. It continues on to say healthcare workers, they're not included in the initial rollout, resident staffs of all other congregate settings, and essential workers. So again, I think as the Minister LeBlanc has said, this is a continuous stream of vaccines coming, and that there is no sort of concrete war between the last week of March and the first week of April. We're just trying to put the operational and implementation lens on top of care or congregate living where there are seniors. For seniors is because, quite simply put, in the first wave, 80% of the deaths we experienced in Canada, unfortunately, tragically, were second wave. This is resurgence. We are estimating that still about 70% of the deaths are linked to long-term care. Data is being collected on an ongoing basis, just to say that they're very disproportionately impacted. And so that's fundamentally why that group is there. And age is a very key risk factor. There are underlying medical conditions, of course, but when you line them all up, it's the age that really stood out as being a key to looking at the rollout, particularly when we don't have enough doses. And healthcare workers, again, expect that even if you start in direct contact, the ones with direct contact with patients, there will be, as vaccines become available, more will be considered. Indigenous communities, extremely important that we, as provinces and territories, roll out their programs, that equity and the engagement in Indigenous communities is very important. You've just seen in this resurgence that is more widespread than geographically, for example, than the initial ones, that many more Indigenous communities are affected, but also urban Indigenous communities as well. So the NACI recommendations are guidelines, and then the provinces they are actually going to look, I think there's going to be quite a lot of coherence across them. So that's what we've been doing with chief medical officers to strive for an evidence-based approach, but also an equity-based approach.
Yeah, Dr. New, just to add a little bit to what Dr. Tam is saying, is that certainly when you look at the NACI recommendations, they look at the best scientific evidence, look at the experience both in Canada and internationally. And I think the overall goal for that committee, but also that when we then take that advice in terms of the Special Advisory Committee, is to reduce morbidity, mortality among Canadians. And then if you take it to another level, how do you do that in the most effective and efficient manner if, let's say, at the beginning especially, you have limited doses? And so looking at those at greatest risk to actually acquire the infection, have disproportionate consequences, and also be at greatest risk to transmit to others. Those are some of the factors that were in play as we came out with, obviously, these priority groups that we're continuing to discuss in terms of then, to Major General Fortin, how do we operationalize it with our provincial territorial counterparts in terms of actually vaccinating Canadians? Thank you.
Thank you. We will take a final question from the room. Thanks. No, this is going to be our last one for today, sorry.
On vaccine tracking, what responsibility do each of the provinces and territories have in tracking who has received what vaccines and when they need to get their second dose? And does the federal government have any role in that?
Yes, the province territories are responsible for the immunization programs, including terms of, for example, if you want to collate information at the national level, there are standards in terms of the actual data that gets reported. So setting some of those. And if we're providing, I guess, financial support, if provinces and territories need it to support their information systems, for example. And we're also looking at an information technology and IT platform that can then track the delivery and implementation of the vaccine program across the country as well, which will help support the province and territories as we begin to sort of roll out the information. But the fundamental answer to your question is that the province and territories are responsible for tracking the first and second dose and making sure that people are recalled and receive the right second dose.
Afternoon, Glenn McGregor, CTV News. In the absence of somebody from Health Canada, and I understand you're following the regulatory process and approval process very closely, could you explain exactly where we are today and what steps have to be gone through before we get to the approval decision? Are they waiting for more information? Are they writing a report? Are they going to have a meeting as the US FDA is going to be doing at the end of the week? What exactly is happening between now and approval?
At Health Canada, as I think everyone's aware, what they're doing in this expedited process is, they're not cutting corners, but certainly more people have been brought to bear in terms of the file. What also they're doing this time is what we call a rolling submission. So as the data becomes available from the company, they are submitting it to our Health Canada colleagues, and they're looking at it. My understanding is that they're in the final phases of that a decision is forthcoming shortly. I'm not sure, Dr. Tam, do you have anything else to add to that?
Data? They don't have all the data yet?
This was as of a few days ago, right? It's still, I think, Dr. Sharma, I think, has also indicated that, yes, they were still in the process of getting some other bits of data. And I can't speak to that. Maybe I'm not characterizing it right. But yes, they want to make sure that they certainly have as complete a dossier in terms of all of the data information that they require to do, obviously, the most complete and comprehensive job in terms of looking at it for a regulatory decision.
Thank you, everyone. This puts an end to our press conference. Merci à tous. Ceci met fin à notre conférence de presse